Hi everyone, Hi everyone, sorry, I think there might have been a small glitch there. I am Dr. Andi. I am so excited as always to be doing today's Facebook Live. Um, while I give all of you the opportunity to join, I'll give you a little bit of background about myself, who I am, and then I'll dive into answering your questions. I always try to get to all of them, so hopefully I'll get to all of them again today. I'm a naturopathic physician. I've been practicing in Toronto, Canada for about 13 years now. It always sounds crazy when I say that. My practice and my area of focus is a lot of hormonal balance, metabolic nutrition. We work with a lot of people who have chronic illness like chronic fatigue, fibromyalgia, chronic Lyme disease. Our other focus are those individuals who are looking to live longer, sort of that regenerative longevity medicine piece. And then we deal a lot with cognitive decline as well. So within that space, our foundation is really the keto low carb foundation. Interestingly, I was at a conference this weekend, and the conference was focused on environmental medicine. And really, what most of the speakers were talking about or mentioning was using the ketogenic diet as a foundation for most of their protocols. So, talking about things like mold toxicity, Lyme disease, chemical exposures, chronic fatigue, a lot of those chronic conditions that lead to sort of unexplained symptoms. And the majority of the speakers, when they were talking about their treatment overall and how they approach it, the foundation for their treatment was always looking at the keto and low carb diet as really one of the most important things when it comes to treatment overall. So that was really interesting to listen to, and something that I obviously really enjoyed listening to as well. Lyme disease is a primary focus in my clinic and in my practice. There's also a really big COVID focus as well. I also had COVID these past few weeks, which is always fun. I lasted 2.5 years and finally got it. So there was a really big COVID focus as well. But one of the main and primary topics that really kept coming up at the conference was ketogenic diet, low carb, getting the sugars out of your system in order to optimize immune function, inflammation, detoxification. So it was a really interesting conference, and of course, the keto content was super interesting to me as always. So I'm going to get started answering your questions. I can see some of your questions slowly starting to come in. As I mentioned, I will try and get to all of them as best I can. I wanted to start a little bit talking about fasting. That's a question that we get quite a bit, and that I get a lot during the lives on Wednesdays as well. Intermittent fasting, how I do the fasting, how I introduce it with my patients. So I thought I would start with that today and give you a little bit of a background on fasting and how I introduce that with my patients and why. So intermittent fasting is something I introduce with most of my patients in the very beginning. It's something that's very easy to introduce even when a patient can't begin some of the dietary changes or even taking some of the supplements that I'd like them to take. So the way I have my patients do that is starting with a 16-hour fast, so from dinner until their first meal the next day. So 16-hour fast, about 5 nights a week when possible, a 24-hour fast once a week, and then a more extended fast or a reboot once a month. So that's how I'd like my patients to space that out. And I find that that's a really good prep for somebody who is looking to engage in longer fasting. So if you're looking to start something like a reboot or something like that, then introducing that intermittent fasting is a really good way to prep. Or to get yourself ready for the more extended fasting, if that's something that either makes you a little bit nervous, or that, again, some people might not feel great when they initially fast. That's a really good way to get started. What's the difference between a long fast and a juice fast? So juice fasting is essentially all you're consuming is juice. It doesn't necessarily have a time frame on it. I know some people have done a juice fast for a month. I don't recommend juice fasting personally. It's a very high sugar fast when people do a lot of the juice fasting, so I don't generally recommend sugar fasting. The benefits that we're trying to achieve from fasting are getting our body into autophagy or autophagy, which is that innate cleansing process. So that process where we clear out damaged cells, it's an immune reset, a metabolic reset, an inflammatory reset. And the one thing that will disrupt the fast or stop your body from getting into autophagy is a spike in insulin. And what spikes your insulin? Sugar. So if you engaged in an extended juice fast, your body won't really get into autophagy if you're consuming sugar regularly. Again, it depends on how long you're doing the fast. Obviously, if you're doing a 5-10 day juice fast, then eventually, yes, you will eventually turn on autophagy if you can get those insulin levels low enough. So I don't generally recommend that my patients do juice fasting. I do recommend that they do more intermittent fasting, or sort of the extended fasting like the Reboot or something like that. And then during that time, you're still consuming things like water. You can have coffee without sugar in it, and things like that. So that's usually what I recommend, just to make sure we're optimizing that process of autophagy. How many NATs would I suggest in a day? Right now you're taking 1 in the morning, 1 in the afternoon, and a caffeine-free at bedtime. So that's great. 3 a day is fantastic. For people who are just getting started, I'll often recommend just starting 1 a day. Just start once, usually in the morning on an empty stomach is what I recommend. Or if you're working out and you want to use it as a fuel for your workout, then I'll suggest taking it 30 to 60 minutes prior to your workout. So that's usually how I recommend to take it. And then the number of servings in a day depends on patient goals, and then also what we're treating. So if I'm looking for a more therapeutic outcome, I am asking patients to take it 2 to 3 times a day. Taking it twice a day is generally sort of a good rule of thumb, starting your day with the ketones and then introducing at another point in the day in the afternoon. So usually that's how I recommend it. The more frequently you take it, the higher the level of ketones you will have in your system. So you will be in sort of a nutritional ketosis a little bit longer, because obviously when taking exogenous ketones, if you're not in nutritional ketosis, you'll have that elevated blood level and eventually it will leave your system. So if you're able to take it more than once a day, that's fantastic. But if once a day is all you're able to take, or you're just starting, then that's what I recommend, and that's not a problem. You just understand that you're not going to be in ketosis for the rest of the day, but you will still get the benefits from that serving that you had in the morning. You're very itchy taking NATs. Is that normal? You drink 2 NATs a day and 2 Mitoplex, 150 ounces of water. So no, that's not usually a normal outcome from drinking exogenous ketones. I'm wondering if you have maybe an allergy or a sensitivity to something. So no, that's not usually a general outcome. So what I usually say to patients when it comes to supplements is that there's generally a certain expected outcome, but that doesn't mean that everybody will have that same outcome. You can be sensitive to anything, you can be allergic to anything, and so it might be entirely possible that there's just something in it that doesn't sit well with you. I would test stopping it as well to see if that makes the itching a little bit better. And then also I would work with your provider and check into allergies and histamine levels and all of those things as well. So sorry, lots of questions, trying to get to all of these. So how do you experience weight loss if you're not following a ketogenic diet? So you will still experience the benefits of exogenous ketones if you're not following a ketogenic diet, but one thing I always like to emphasize is that exogenous ketones are not a weight loss supplement. So that's not what they are, but some people do see fat loss as a secondary benefit to what the ketones are doing in your system. So the impact that BHB or beta hydroxybutyrate might have on cravings, for example, the impact it will have on leptin and ghrelin, appetite control, the impact on our insulin levels and our blood sugar levels, impact that it might have on our inflammatory cascades, or the impact it has on the gut. All of those things can also impact our body's ability to lose weight. However, again, and I've said it before, taking a supplement can't erase all of our, poor dietary or lifestyle choices. So as a doctor, I'm always encouraging my patients to make those lifestyle and dietary changes as possible. If you're not in a place where you're able to make significant change, then the first thing I ask my patients to introduce is intermittent fasting. It's the easiest thing to introduce as a start and shows really significant benefit. If weight loss is your goal, men, of course, lose weight much faster than women with intermittent fasting. But if that's your goal and making significant dietary change is not an option, then I recommend the fasting while taking the ketones so that you still get the benefits of BHB in your system. So that's usually how I recommend doing that. If I'm not doing keto, will drinking the NATs help? Yes, absolutely. So that's the whole point of taking exogenous ketones, is that a lot of people are not able to follow a ketogenic diet. A lot of people are not able to stick with a ketogenic diet. It is a bit more challenging for some people to do that. And so taking exogenous ketones will elevate your blood level of ketones as if you're in nutritional ketosis. So you still get the benefits from the beta hydroxybutyrate even if you're not following a ketogenic diet. So that's really one of the primary benefits of taking it, is that if you're not keto, you still get benefit for it. And what they have found is that, because a lot of people ask, but if I am keto, will I stop making ketones if I take exogenous ketones? And the answer to that is no. What they've actually found is that those benefits are cumulative. So if you're following a ketogenic diet and you take exogenous ketones, what they're finding is that it actually amplifies the benefit. You see even greater benefit when you're doing both versus just one over the other. So again, best benefit when you're keto or low carb with the ketones, but you still get really significant benefit if you're not following a ketogenic diet, and even if you haven't made any dietary changes. And again, if you're not at a place where you're able to make those dietary changes, I really encourage the fasting and the intermittent fasting. So gallbladder. So lots of gallbladder questions I've seen here actually. So if you don't have a gallbladder, yes, you can absolutely still take exogenous ketones. I saw a comment about ox bile. I always recommend ox bile for those who've had their gallbladder removed. Very, very important whether you're following a low-fat diet or not, to take ox bile. I never encourage my patients to follow a low-fat diet. I always want them on a high healthy fat diet. So whether they're keto or not, if someone's had their gallbladder removed, I'm asking them to take ox bile. From a dietary standpoint, but if you're taking exogenous ketones, that's not really necessary. It doesn't really impact the gallbladder in that way, and the same thing goes for coconut oil, as you probably won't have issues taking coconut oil either. But again, I'm always encouraging a high healthy fat diet, so the ox bile is essential to help your body digest fats and kind of take over the function of the gallbladder now that your gallbladder isn't there. Some flavors are causing tummy issues. So I don't know if you mean that you take some flavors and you're fine, you take another flavor and it causes some digestive issues. If that's the case, of course, obviously, first thing, avoid the flavor that doesn't sit with you. As I mentioned earlier, that we can be sensitive to anything. So any change in ingredient or formulation can absolutely impact people in different ways. So if you find that certain flavors don't sit well with you, then I would just avoid them and take the other one. If you are experiencing tummy trouble, make sure you're taking, if it's constipation or diarrhea, make sure you're getting your electrolytes. So put your Mitoplex and mix it right in with your ketones. And make sure if it's constipation that you're taking your magnesium. And then if it's diarrhea, I usually just recommend reducing how much you're taking until your system adapts. So reduce the amount that you're taking, maybe a quarter of a sachet or half a sachet, and take it with a little bit of food. So what are some of the healthy fats you recommend? So I recommend coconut oil. I love olive oil. That's a really great one. Avocado, eggs, salmon. Those are some of my the top fats that I consume regularly. I do consume butter as well, organic or grass-fed butter. So how do I recommend starting intermittent fasting? Usually I just have my patients dive right in. So a 16-hour fast from dinner until the first meal the next day. And in that fasting window, they can still have their coffee, or if you have buttered coffee, you can have a butter coffee. I always like to make note with butter coffee though. I love my butter coffee, but I'll only drink it in a fasting window. I'll never drink a buttered coffee if I'm actually eating breakfast, because that's just a little bit too much fat. So my butter coffee I only reserve if I'm fasting. And then if I'm eating a meal, it's just a normal coffee with a little bit of coconut milk in it. So I usually recommend that 16-hour fast. Having your coffee or your ketones in that fasting window is not a problem. Some people can't go 16 hours right off the bat. If our body is very carb or sugar adapted, that 16-hour fast is just too much for our system. And so sometimes I have my patients start at 10 hours. And then once they feel okay with that, we move up to 12 hours. And when that works, we move up to 14 hours. So it's a really slow incremental increase until they can get to that 16-hour mark. And then when we get there, we talk about 24-hour fasting. But for the patients who can't do that, I say start low. So if you do a 16-hour fast, I had a patient come in and tell me she was just starving, she couldn't do it. She was cranky and all of those things by, by noon when she was eating, and I said, okay, well, let's just bring that down to 12 hours until your body adjusts, and then we'll move from there. So you just have to do what works. You have to do what works for you and what feels right for your body. Is it safe to take MCT with epilepsy? Yes, absolutely. I do always recommend in those cases to take MCT oil. So yes, absolutely, that's safe to take. Of course, talk to your healthcare provider. Make sure they tell you that it's safe to take. But yes, absolutely, I personally, for my patients, would suggest to take it, but talk to your healthcare provider. So lots of questions about ox bile. So yes, add your ox bile in. Definitely add your ox bile in if you've had a gallbladder removed, no matter what kind of diet you're taking. But ketones should not negatively impact your digestion just because you don't have a gallbladder. What do you do for diarrhea? So for diarrhea, I don't know if that means diarrhea being caused specifically from taking ketones. If it's from taking the ketones, reduce the dose, add, take it with a little bit of food, something like some avocado or something like that. Add in some Mitoplex. And those things are very, very helpful. And then in general, obviously you can add in some probiotics, and there are a lot of other things that you can do to help as well. You drank 2 ketones with Mitoplex and you're still having muscle cramps. So if that's the case, I would also add in some magnesium and possibly even potassium depending, but I'd add in some magnesium before bed. Usually I say, because we know that ketones can act as a bit of a diuretic, so we know that that's true, and we can lose some of those minerals. So I always suggest taking magnesium when we start a ketogenic diet. But also I say that it kind of shows us where our deficiencies are. Most people are magnesium deficient. A lot of us are lacking those minerals, and sometimes we just need a little bit more. You can have your healthcare provider test your RBC magnesium. So they can check that for you to see if you're deficient, but obviously an easy way is just to take some before bed. So I usually always have my patients taking magnesium. So as a start, anytime I have patients start a ketogenic diet or exogenous ketones, I'm having them take a multivitamin, electrolytes, a B complex, and magnesium. So that's kind of my 4 supplement starter. Those are the things that I kind of say are like the mandatory start to prevent keto flu, muscle cramps, anything like that. That's always what I have. It's always what I have my patients start with. Will MCT oil help with a facial injury if you apply it? Do you mean to apply it topically? You hit the concrete in a run. Oh, I'm so sorry to hear that, Amy. So you obviously had a fall. I think you're meaning topical MCT oil, and you're not really talking about like a traumatic brain injury or a concussion or anything like that. So I don't know if it's going to help topically, to be honest, from a facial injury in that way. There's a lot of research looking at the role of beta-hydroxybutyrate in ketones from head injury. I would still take it orally, just in case there is like mild concussion or anything like that. It sounds like that was a pretty big fall. So there's a lot of research looking at the role of beta-hydroxybutyrate and concussion, TBIs. So we know that there is some benefit there. So I would, make sure you're getting all of those things into your system. But in terms of topical, that's not necessarily what I would apply for healing. There are a few other things that I would probably apply. Again, I don't know what kind of facial injury you've had, so I can't really say. But I know they use a lot. So Medi-honey is something that we often use here as a topical. It's used often in hospitals for diabetic ulcers, things like that. But again, just depends on what kind of injury that you have. But that's always a great option. But I would make sure that you're taking those things orally just to optimize cognitive function after any type of hit to the head. Why do I feel thirsty after drinking ketones? Because it acts as a bit of a diuretic. So as I mentioned earlier, we can lose some of our minerals. And so it's important that you don't just drink a lot of water, but you get those electrolytes. You get those electrolytes back in. So I just put your Mitoplex right in with your coffee, and that should help with the thirst that you're feeling. Does your butter coffee break your fast? No, my butter coffee doesn't. So in the fast, what I'm putting in is pure organic grass-fed butter and then some MCT oil. And it doesn't break the fast because what will break the fast is the spike in insulin. And so what spikes insulin? Glucose. So if you have anything with sugar in it, you'll break your fast. And then also if you have too much protein that can convert into glucose, that will spike your insulin, and then that can break your fast as well. But the things that don't spike insulin are fats. So having some of those fats in your coffee in the morning will not break your fast, will actually help to keep you full and will fuel the brain, optimize cognitive function. So I actually find when I'm fasting and I have the butter coffee, I feel more mental clarity, mental focus, and I'm not breaking my fast when I do that. Pre-diabetic, is it good to take ketones? So if you're diabetic or pre-diabetic, you definitely have to work with your healthcare provider or find someone in your area who is knowledgeable in the ketogenic diet, and especially with exogenous ketones. So is there benefit? Yes, there could be benefit in that space, but this is the one area where I see people have to be careful if they are diabetic. So with diabetes, the only time with type 2 diabetes that there's a really significant concern is kind of end-stage diabetes. The concern is ketoacidosis, when the body's not making insulin. So you need to make sure that you're a controlled diabetic. Because you're pre-diabetic, you're at a really great opportunity to reverse that. We know that type 2 diabetes is onset from our dietary choices. So the first thing I'm doing with my diabetic patients is I'm having them fast, having them go keto. The first thing you need to do is get the carbs out of your system. And then I do have them take the exogenous ketones as well. But again, you have to work with your healthcare provider and make sure that they say it's safe for you. What's buttered coffee? So buttered coffee is exactly the way it sounds. It's a coffee where you put butter and MCT oil in it. Pruvit has sort of their own version of that in the keto cream. That helps sort of give the version of that butter coffee as well. So that's also an option. I know with the butter and MCT oil, it doesn't sound great, but just tastes like a latte. And that helps sort of, again, fuel and allow you to extend the fast. Do I have a recommendation for ox bile? I don't know if you mean a brand. There are a lot of companies that make ox bile. Honestly, if you sort of Googled ox bile, go to Amazon, you'll find a lot of companies that do that. Just make sure you're using sort of a professional brand. Don't pick the cheapest one. I always say you get what you pay for. So if you're kind of Googling, you're not sure, aim for something in the middle or closer to the higher end range in terms of pricing. Don't pick the lowest price one that you find, but there are a lot of companies that make ox bile or that make a digestive enzyme that contains ox bile in it. Which magnesium do I recommend? So that depends. So I often recommend magnesium threonate for a lot of my kind of chronically ill patients or patients with anxiety. The threonate is very calming to the nervous system, so I do a lot of magnesium threonate or a lot of magnesium bisglycinate. I don't do a ton of magnesium citrate because that acts as a pretty significant laxative. So it's helpful if you're constipated. If you're very seriously constipated, magnesium citrate is helpful. If that's not a huge issue for you, then I would use threonate or glycinate. Do I believe that a 16-hour intermittent fast is good for most adult women, or different eating windows based on our age? So I don't do it based on age. Obviously, adults only. I never introduce fasting in any sort of young women. I'm even hesitant to do it with girls who are in 20, 21. The last thing you want to do is create disordered eating patterns. So obviously only for adult women. And it depends on each individual. So not based on age. I would say it's based on each individual patient and how they feel. We're the best judge of our body and what feels better for us. But most women are fine doing sort of the 4 to 5 days a week. And then I always tell people, just listen to your body. If you wake up one morning and you want breakfast, have breakfast if you feel that your body needs it. So it's not like we're trying to force ourselves to starve or force ourselves not to eat. So really listen to your body with the fasting. And if it doesn't feel right that day, then stop. I always intermittent fast. I love it. Yesterday I felt like I wanted breakfast, so I had breakfast. Just because I was starving, I was hungry, and the intention of fasting is not to starve yourself when you feel like you want to eat something. I was hungry, I had breakfast. So you just have to go with how your body feels, what feels right for you. It's not age-based. I know there's some marketing right now on Instagram that will talk about, the correct fasting method for, somebody in the early 20s, somebody 30 to 40, if you're perimenopausal, if you're menopausal. So I have seen the marketing for that as well, that they base it on your age. But no, you don't have to change it based on age in that way. Lots of ox bile questions again. So when being diabetic, when you fast, how do you recommend doing that? So I don't know if the concern is because you're on medication. So usually with diabetics, you just need to make sure that you're monitoring your blood sugar levels. Make sure you don't become hypoglycemic. So that's where you're going to have to make adjustments in that fasting window. So if you're starting to feel hypoglycemic, make sure again that you're monitoring if you're on medication. I'll often have my patients change diet first if they're diabetic and then move into fasting. But yes, I do have my diabetic patients fast, but again, talk to your healthcare provider and make sure they said that that's okay for you. But I do a slow transition in if you're on medication. And what I'll want patients to do is make adjustments to their medication, not adjustments to the carb content. You hear a lot of providers say, oh, you're hypoglycemic, your blood sugar is too low, eat more sugar. No, adjust the medication. That's what we want to do. So you have to work with a provider who's willing to do that with you and who's willing to make adjustments to your medication as your blood sugar starts to go down, and who's willing to help you adjust that medication while you're fasting. There's a nephrologist in Canada, actually, he's a specialist now in fasting ketogenic diet, and he does a 5-day crash fasting for his sort of obese and also for diabetic patients, and he just but they're medically supervised, obviously. So you need to find a provider who is well-versed and knowledgeable and who will help you and who will help make those adjustments as you need, and who aren't going to say just eat or eat more sugar if your blood sugar starts to drop. They'll work with you to adjust medication as needed. When I drink ketones, I feel like I could fall asleep. Is that normal, or is it because caffeine makes me tired? So there are two questions in there. The first question is, does caffeine make you tired normally? If that's the case, where you feel that caffeine normally makes you tired, then obviously take the caffeine-free version. Then you have to figure out why caffeine makes you tired. Often when caffeine makes you tired, it's because you're in adrenal fatigue. And so what you're trying to do is stimulate adrenal glands that are already kind of burnt out. So when someone tells me they take a stimulant and feel worse, it's usually because you're in adrenal fatigue. So I would probably look into that as well. And then also to make sure that you're getting enough electrolytes. For my patients in adrenal fatigue, they have a really, really high need for electrolytes. I even have some of them start their morning drinking Himalayan salt and some lemon just to get that sodium into the system. So it could be that you really need to up your electrolyte consumption, your salt consumption, to really replenish some of those things. But for you, I'd say there are probably some other things you have to dig with your doctor or your provider to see why those things are happening for you. But no, that's not a general outcome when somebody's fatigued from caffeine. But the fatigue from taking the ketones is likely due to loss of minerals. So I would look into those things as well. Okay, so to go low carb, then go into fasting. Kind of, yes, absolutely. Going in fasting will help you go low carb for sure. And that's usually how I introduce transitioning to keto with my patients, is I have them fast, take the ketones in that fasting window. You're essentially skipping breakfast when you're intermittent fasting, and then you have 2 meals left in the day. And then usually I'll say pick the meal that contains the carbohydrate. So if you have a carb at lunch, then you can't have a carb for dinner. If you want to have carbs for dinner, you can't have a carb at lunch. So you end up having carbs sort of in one of your daily meals, and that's a really great and kind of simple way to start getting the carbohydrates out. And I find that that's very easy for patients to follow. It's not making massive changes to your diet, it's just taking a carbohydrate out of one of your meals. So that's generally how I like patients, how I get my patients to start. And yes, fasting is super helpful in getting you to transition into that sort of low carb space. Why do you get headaches when you do the reboot? Again, you're probably dehydrated. You might want to do some intermittent fasting in the month leading up to it, so to adjust your body to it. So a lot of people can get headaches. You could be having a bit of a detox reaction. It could be, if you've cut out the sugar and you normally eat a lot of sugar, that could cause a headache. It could be sort of a bit of a keto flu that you're experiencing. Again, so play around with intermittent fasting the month leading up to the reboot, and make sure you're getting tons of electrolytes. You shouldn't have to take 2 Advil every time you do a reboot. So just make sure, again, you're getting your minerals, your electrolytes, those 4 supplements that I mentioned a little bit earlier as an adjunct or sort of an add-on to your supplements are also very helpful. So that's usually how I recommend my patients do that and how they start. So I think that is it for today. Of course, our time flies by as always. I hope I got to most of your questions. Lots of questions about ox bile. I love ox bile. I use it all the time with my patients. So hopefully I answered everything. So enjoy the rest of your week, everyone, and stay safe, stay healthy.